Hi, everyone. Welcome to the Perfect Dose Podcast. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. On today's episode, we are talking all about the eyes. The eyes are one of my number one areas that I get requested to treat by patients in my practice. People are coming in and they're like, what can I do about wrinkles around my eye? How can I treat dark circles? What can I do for hollowing? And on today's episode, we are going to talk about all of that. We are going to discuss the causes of dark circles, causes of fine lines around your eyes, causes of hollowing. We are going to talk about treatments that you can do at home, treatments that you can do in office, and how to know which you are a candidate for. But before we get into it, I am going to give you guys a little update. It has been freaking insane lately. It's injector season. And if you're an injector and you're listening right now, it is like the crazy season in the holidays. Holiday time for injectors is like the most amazing time, but it's also the busiest time. And if you're a patient and you're listening, you better book your Botox like now because spots are going to be completely booked. It is my favorite time of the year, but it is super busy. So I wanted to share a little bit just about balancing time because a lot of you listening might be like, okay, well, if you follow me on Instagram, you see that I'm a mom, I own a business, I'm an injector, and it might look like things are very easy. And often on social media, things do look very easy, but I wanted to share with you guys just a little bit about where I am right now because it has been a struggle to balance everything and it's hard. And oftentimes when I feel like I am succeeding in one area of my life, I feel like I'm not succeeding in another area of my life. So there are days that I'm like, oh my gosh, I'm a bad mom because I'm working too much. I'm having to do content. I'm doing my business things, but I'm succeeding and doing so well at Perfect Dose. And then there are days where I'm like, you know what? I just need to spend time with my baby. So I have the best days with Jax and we cook together. We play at the park. We ride bikes, but then I don't get a lot of work done. And I'm like, oh my God, I wasn't productive enough. So it is a constant struggle. It's a balancing act. And even right now, as I film this podcast, I'm literally filming at like 8 p.m. because I tried to film earlier and Jax has been sick. So it was just tough. And I wanted to spend time with him. I didn't want to leave him to film the podcast. So I was like, you know what? I'm going to spend time with Jax. I'm going to put him down. And then when he goes to sleep, I'm going to do my podcast. So just a little bit of encouragement that it takes consistency, it takes discipline. And even though things seem so easy on social media, they oftentimes aren't. It is all about showing up and time managing. And I just wanted to share a little bit about that. So let's get into today's episode. Dark circles. What are they? Why do we have them? So dark circles happen underneath your eyes and they can be due to a variety of things. They can be due to lifestyle factors, lack of sleep. That's a huge one. Genetics, allergies. There are multiple causes for dark circles underneath your eyes and even lack of hydration. So if you're listening right now, we need to make sure you're getting enough sleep, number one. And also that you're staying adequately hydrated. And when I say getting enough sleep, I mean 8 hours every night. And that's super hard. I feel like even for me, I struggle. I try to go to bed early. I try to wake up early. Sometimes I can't put my mind at rest, but try to get sleep and you will see a significant improvement in your under eyes. And also drinking enough water. And this is something that not a lot of people talk about, but having your skin adequately hydrated makes a difference. Your skin looks healthier, your under eyes will look healthier, you'll look less tired. So those are two easy things that you can go home and do no matter what to improve dark circles underneath your eyes. But how do we know what is causing the dark circles underneath your eyes? So I'm going to show you guys something called the pinch test and I'm going to look really crazy. So if you're watching right now, just know that I'm doing this for you. If you're listening, then I'm going to sound like a crazy person, but hopefully I can walk you through this and you can understand exactly how to do this test in the mirror to see what is the cause of your dark circles under your eyes. So look in the mirror and I want you to literally pinch your skin underneath your eye. And don't do this hard because the skin underneath the eye is very delicate. The eye is an amazing area to treat, but it has delicate skin, so it needs to be treated accordingly. So pinch the skin underneath your eye and lift it up. And when you pinch that skin, if you see dark circles, like the darkness goes away, and then you let your skin down and you see dark again, that means that your dark circles are due to anatomy, something underneath that is causing the dark circles. if you pinch your skin up and the darkness stays, like you can literally see darkness on the skin, then that means your dark circles are due to hyperpigmentation. And the two treatment options are going to vary completely. So if you have hyperpigmentation, meaning when you pinch and that darkness stays on your skin, we need to do something to lighten the skin. So treatment options for that are going to be hydroquinone. That is the gold standard for lightening the skin. It does come with some side effects, some irritation. So just understanding that that is a potential side effect. And also it has to be prescribed by a doctor. Something that you can do at home that's super simple, and everybody should be doing this, even if you don't suffer from hyperpigmentation, dark circles, you should be using a vitamin C serum. And one of the highest potency pigment inhibitors is vitamin C. Vitamin C is a powerful antioxidant. It helps stimulate collagen. It is protecting your skin against UV damage. It also is a go-to for treating uneven skin tone and texture, especially hyperpigmentation. So that's something that you can do 100% right at home. And understanding if this is the cause of your dark circles, it is going to take multiple treatments. It is going to be a journey. It is not going to be a one-stop shop, and it's often going to take multiple treatments to get the best possible outcomes. So if you did this pinch test and you noticed that the dark circles went away and your skin was completely normal skin color, then that means your dark circles are due to anatomy, and particularly thin skin. Now, if you have thin skin underneath the eyes, everybody does, but if it's causing you to have dark circles, what we need to do is thicken the skin. So the treatment options are going to be all centered around thickening the skin so that your anatomy, your vessels underneath your eyes aren't showing as much. So what can we do to thicken the skin? Now, at home, I'm going to recommend retinol. And it's very important that you understand not just any retinol. If you guys are using tretinoin or using retinol on your face and your body, you cannot put this underneath your eyes. It is going to be very irritating to the skin underneath your eyes. The skin underneath your eyes is super delicate, so we need to be using a low dose retinol. The dose that I recommend for my patients is always going to be a 0.25% retinol. So super low. To put that in perspective, usually the retinols that you're using at home are like 0.5% or greater. So 0.25% is going to be my recommend dosing. I love EyeMax by SkinBetter. It is one of my favorite products that I recommend underneath the eyes all of the time. I will link it in my show notes. That is like my go-to retinol for underneath the eyes. So that is what I recommend to do at home. In office, my go-to recommendation is going to be something called PRF Easy Gel. And PRF stands for platelet-rich fibrin. So what is this product and how do we use it? You guys might have heard this on TikTok. It is trending all over TikTok, but PRF Easy Gel is when we actually draw your blood and we spin it down in a centrifuge. And that centrifuge is going to separate your red blood cells from your platelet-rich fibrin. And think of your platelet-rich fibrin as all the good stuff, your growth factors, things that are going to help stimulate collagen and improve your skin. So we have this separation and then we draw it up in a needle and we will literally inject it underneath your eyes. And what's really cool about this PRF Easy Gel, it is different than traditional PRF. So I'm going to break this down for you guys. If you're listening and you don't have hollowing underneath the eyes, you just have dark circles, you may be fine just getting traditional PRF, which is platelet-rich fibrin. Same process that I just described. It just doesn't give you any volume because it's a liquid. It's literally from your blood. Now, PRF Easy Gel, which is why I always recommend this one, because most people don't just have dark circles, they have dark circles plus hollowing. And PRF Easy Gel is literally going to take that platelet-rich fibrin, so it's like an extra step, and it's going to create your own filler, like a biofiller. And this is going to add volume, which is really, really amazing. Now, some of you might be listening and you're like, well, why isn't everybody doing this? And it's because there are some potential benefits and potential downsides to this. So benefits of this treatment is that it's your own. It is your own autologous blood, which means nothing can go wrong from it. You can't have a reaction. It's your own. So it's super safe. It's super effective. Now, downside of this is I don't know the quality of your growth factors, and growth factors are going to decline with age, with lifestyle factors, drinking alcohol, smoking, even being outside in the sun. There's a number of things, eating sugar, that can impact the quality of your growth factors. So I tell my patients there is a 50% chance you're going to get amazing results And then there's a 50% chance that you don't. And I don't know that until we do it. Another downside is that you're going to need multiple treatments. But like with anything, it typically takes multiple treatments to achieve the best results. So it is my go-to recommendation if you suffer from dark circles and hollowing underneath your eyes. I absolutely love this treatment. It is highly effective. It just may take multiple treatments in order to get the best outcomes. And you may just get an improvement. You may not get the full result that you want, but there are often other treatments that we can do in combination. Now, if your dark circles are caused by allergies, there is nothing that you can do other than take allergy medication. And that's because treating underneath the eyes, although it will help add volume, it will stimulate collagen, it will be absolutely amazing, you're still going to suffer from dark circles because of your allergies. So that's just something to keep in mind. If you're a provider and you're listening, make sure you guys do a thorough medical history on all your patients so you can really help determine the cause of their dark circles or under eye hollowing. The next under eye complaint I'm going to talk to you guys about is fine lines and wrinkles. Fine lines and wrinkles are the lines around your eye. These are often referred to as the crow's feet. Now, there are two types of lines when we talk about fine lines, wrinkles in the cosmetic world. There are dynamic lines or lines of expression, and then there are lines that don't go away at rest. So dynamic lines can be treated with neuromodulators. And for the purpose of this podcast, I'm going to refer to all neuromodulators as Botox because it just rolls off the tongue a little bit easier. So Botox is used to treat this area. This area around the eye is treated with Botox because those dynamic lines, when we smile, we laugh, we talk, are caused by a muscle. And that muscle is the orbicularis oculi. And the orbicularis oculi is a muscle that when we smile, it closes your eyes. Also, when you're squinting, we use that muscle. When we are lifting our eyebrows, we're using our frontalis muscle, which is our forehead muscle, but it lies very close to the muscle around the eye. So it's very important that you go to an experienced provider when getting injected in this area, because getting Botox in this area, if you are not the right candidate or if you don't go to somebody that understands proper placement, can actually look really weird. So we're going to talk about that. The first thing that can happen when you get injected with Botox around this area is if you get injected with too many units too low, you can get what's called a shelf appearance. And for those of you watching, I'm telling you, I'm just going to look freaking crazy throughout this whole episode, but I want to show you what I'm talking about. So if you put your finger underneath your eye and you smile and you see this like space, it looks freaking bizarre and weird. That's what I'm referring to as a shelf. And this happens when you get too much Botox too low and it relaxes the muscle so much that when you smile, nothing moves. And that looks very unnatural and weird. So how we avoid this is we actually titrate our dosing down. So typical dosing in this area is going to be 12 to 15 units per eye. So 24 to 30 units total. And I will do the highest dose by the lateral brow. So I will start with the highest dose and I will work my way down. I will lower my dose as I get lower down the eye muscle. And that is to avoid the shelfy appearance. Now, something that we can also do with Botox around the eye to treat fine lines and wrinkles due to muscle is we can actually treat something that's called the jelly roll. So when you're smiling and you see this little like bulge underneath your eye, that's called the jelly roll. We can add 1 unit of Botox in this area and it softens that and looks absolutely amazing. Now, again, important to choose an experienced provider because you may look weird with this injection. And what I mean by that is some people, when they get injected in the jelly roll and maybe they're just not a good candidate for it, they've never had it done, it does change your smile slightly. So I always warn my patients, there is a chance that you will look like, people refer to this as a dead eye because when they smile, there's like nothing there. Some people love it because they're like, you know what, I want no lines, so I would rather do this, but some people hate it. So it's important that you go to somebody that talks to you about potential side effects. And I will tell my patients, there is a chance that you don't like this injection. There is a chance that you love this injection, but the good news is that it's going to wear off. So that's a really cool area to treat. The next thing that we can do with Botox around the eye is we can actually treat right underneath the eye. And I think it's funny. I actually had a patient come in the other day and she was like, oh my gosh, I don't want to get Botox underneath my eye because TikTok told me that it's not safe. And I was like, what? Why? This makes no sense. It's the same muscle. The orbicularis oculi goes all around your eye. So whether you treat the top of the orbicularis oculi, the bottom of the orbicularis oculi, it doesn't matter. It's the same muscle. And also, Botox is used to treat spasms of the eye. So people are literally getting injected on their eyelids for spasms, and it is absolutely safe and effective. I think they're injecting even kids with strabismus and blepharospasm. So those are the medical terms for when your eyes are twitching and when you have spasms of the eye. And you can actually get injected with that when you're 12 years old. It is FDA approved. So that is something to keep in mind. It is very safe and effective. I just thought I would mention that. But the thing that can happen, and what I did talk to this patient about, is sometimes if you inject this area, you have to make sure that you are the right patient and that your skin is tight enough for it. So if you have something called skin laxity, meaning your skin isn't as tight and bouncy as it once was, you should not get injected in this area. And that's because, like we said before, the orbicularis oculi is a squeegee muscle. So if we relax that muscle completely and it can't squeegee, it can't pull out our lymphatic fluid, then we're going to look puffy. And it can also make that skin sagging look worse. So what I want you guys to do is another test. So for everybody listening, follow along. If you're watching, here we go. So this test is called the SNAP test, and it's going to be very similar to the pinch test. What you're going to do is you're going to literally grab the tissue underneath your eye. Do this very gentle. The skin is very delicate in this area. You're going to pull it up and let it go. And if your skin bounces back very quickly, that's amazing. That means you have great skin laxity and you can get treated with Botox around the eye in this area. If you pinch your skin and it stays and takes longer to return to normal, then you have skin laxity and you should not get Botox in this area until you strengthen the skin first. So how do we strengthen the skin? We talked earlier about strengthening the skin with PRF Easy Gel, and you can do this to strengthen the skin, but my favorite treatment for actually skin tightening is going to be something called Morpheus, and Morpheus is RF microneedling. RF microneedling is going to be microneedling on steroids. So think of traditional microneedling. It's creating these micro injuries in your skin. Somebody's getting something called a skin pen. Usually that's the FDA approved one. And they're creating micro injuries, and then your body is going to heal and stimulate collagen. And this is a great treatment. You can absolutely consider this. It's going to be more cost effective, but for results, I think skin tightening with RF microneedling is the go-to. And RF microneedling is microneedling with radio frequency. So instead of relying on those needles to create these micro injuries and stimulate collagen, we are actually using these needles to drive radio frequency, which is energy, into the skin, and that is going to stimulate collagen and it is going to tighten the skin. So you can get some pretty freaking amazing results with Morpheus around the eye. We can also do cool peel around the eye, which is a CO2 laser, and that is going to ablate the first layer of your skin. So it's going to take off that first layer. It's going to stimulate collagen, help with fine lines. So lots of skin tightening devices that we can use in this area, and you can even combine it with Easy Gel if you want optimal results. Oftentimes when it comes to the under eyes, if you do multiple treatments, you're going to get the best outcome. And that's not surprising because multiple treatments always gives the best outcome and it always gives the most natural results. And I can't not mention surgical options, because if you do this SNAP test and you have lots of skin laxity, you can also get a blepharoplasty. You can go to a oculoplastic surgeon. You can actually have a surgical procedure to remove that skin and tighten it. So that is a surgical option, but there is also non-surgical option. So I think it's very important to choose a provider that is going to assess you and tell you what you are a candidate for. And if your provider is like promising plastic surgery results without plastic surgery, you need to run. I will always tell my patients, I am not a surgeon. I cannot give you surgical results, but if you want a non-surgical option and you're going to be happy with, let's say, 50 to 80% improvement, depending on the patient, depending on their assessment, then amazing. But I tell my patients all of their treatment options, and that is so important. You need to go to a provider that's telling you the pros and cons of everything so you can choose the best treatment that is for you. Now, we talked about dynamic lines, treating those with Botox and doing skin tightening. We talked about the SNAP test. Now I want to talk about some at-home treatments. So at-home treatments are going to be similar to treatments for dark circles, but we're going to add a few things in. The first thing I'm going to recommend is going to be a retinoid, and retinoids are super amazing in this area. It's important to use a low-dose retinoid. That 0.25% is going to be key in this area, and that's because we don't want to cause a lot of irritation and dryness, and using a retinoid that is too strong is not going to be safe for the skin underneath the eyes. So super important that we are using the appropriate retinoid. The next thing that I'm going to recommend for fine lines and wrinkles is actually going to be a growth factor. I love growth factors. Growth factors stimulate collagen. They actually stimulate 50% collagen. A lot of people don't know this, but retinoids don't really stimulate a lot of collagen. They do, but not a ton. Retinoids really shine for cell turnover. So think new, fresh baby skin. And they absolutely play a very important role in your skincare regimen. But growth factors are something that are a little bit more of an investment, but it is like my go-to treatment when it comes to fine lines, wrinkles, helping to tighten the skin. It is absolutely amazing. My favorites right now are going to be TNS and Plated, and those you can use all over your face. Plated is exosomes. It's like next level. I absolutely love it. You can put it underneath your eyes. You can put it everywhere. TNS is also really amazing for full face, but there's also a growth factor that is specifically for your under eyes, and that is the ZO growth factor. So that's another go-to of mine, and I really love the applicator. So I will post these all in the show notes for you guys so you can decide which one is going to be best for you. I'm always going to tell you retinol is going to be the most cost effective and you're going to get the most benefits. But if you really want to take it to the next level with at-home skincare treatments for fine lines and wrinkles, you need a growth factor. You need exosomes. They are next level. They are like biohacking your life. And I really do think there's going to be so much more clinical data and studies surrounding these products. They are huge for anti-aging. Lastly, I want to talk about under eye hollowing, what causes it and what we can do. So causes of under eye hollowing are going to vary from genetics, from weight loss. We're going to be seeing lots of this right now with Ozempic. We lose volume with age. As we age, our fat pads, the deep fat, the fat that we love, not the fat we don't love, is going to deflate. And you have these fat pads in your mid-face. So when I say mid-face, if you're looking in the mirror, it's the area right below your pupils that extends pretty much down to the bottom of your nose. So that's the area that I'm talking about when I'm referring to the mid-face for this podcast. If you are a aesthetic medicine provider, you may know this area as the anterior medial cheek fat pad. So this is actually going to deflate with age. And it's important to understand this cause because we don't need to just treat the symptom before treating the actual problem. And under eye hollowing is often a symptom, and the problem is lack of volume in the mid-face area. So we need to revolumize that area, and we do that with dermal fillers. Now, there are lots of different dermal fillers on the market. I am going to recommend a filler that is going to give enough lift. It's also going to move naturally with your face. When I inject these products, I inject in the deep plane and then the superficial plane. So I do like a sandwich and it looks absolutely amazing. We age in multiple layers. So it's very important that we add filler in multiple layers. And when you do this appropriately, so choosing the right provider, super important, that understands anatomy in this area, it's going to look very natural. Nobody's going to look like you had any filler. You're not going to look like crazy Kris Jenner apple cheeks. Sorry, not sorry, but I think that looks absolutely wild and unnatural. You will look super natural because we're not putting something there that wasn't there before. You had fat pads in this area that made your face look lifted and youthful. So I'm just simply putting something back that was there before. I'm not there to change your face, just to enhance your face. So typically in this area, you're going to use 2 to 3 syringes of filler for full correction. And the size of a syringe, you guys, is not a lot. For people listening, you might be like 2 to 3 syringes. Holy cow, but 1 syringe of filler is the size of a blueberry. So think about that, 1 little blueberry. So typically you're gonna need a blueberry on each side of that mid-face. And then I have another blueberry that I'm going to split and allow me to treat the ligament that supports the under eye. And that is called your orbital retaining ligament. And this ligament and another ligament called the zygomatic cutaneous ligament, these 2 ligaments make up something called the prezygomatic space. And when you add filler in this area, it lifts and supports the under eye. And most people don't even need under eye filler. I feel like in my practice, I get 90% correction with just treating the mid-face appropriately. So it's super important to understand that. Most people don't even need under eye filler. Then once we treat the mid-face, we can do something like PRF Easy Gel or skin tightening and get an absolutely amazing result because under eye filler can look crazy and weird when it is done in a wrong way and when it is done on the wrong patient. And so choosing the right patient for this procedure is super important. If you have allergies, you are not a candidate for under eye filler. You will get puffy and it will look super, super weird. And if you've never had mid-cheek filler, do not get your under eyes done because you're going to need so much more product in the under eye area that it's eventually going to look weird and unnatural. Minimal is key in this area. I never even use a full syringe in this area. I am doing micro droplets of filler when I am injecting the under eyes. I use 2 to 3 syringes for mid-face all day, every day, and it looks amazing. But for the actual under eye, I am using like baby minuscule amount of product. Less is more in this area. We're like glazing the under eye with product. And oftentimes we are boosting this with biologics to get a better result. And what that means is we don't want to just do filler. We want to do something like with PRP. We want to do exosomes, skin tightening. We want to do things to create real change underneath the tissue. So if you have under eye hollowing, I'm going to first recommend that we fill your mid cheeks with filler, 2 to 3 syringes. And then maybe you don't need any filler at all. You got full correction, or maybe you do need a little bit of filler, and we'll do a little bit of filler and then we'll boost it with exosomes or boost it with PRP. We will add in skin tightening treatments. And this is all going to help the under eye area maintain a natural result. So treatment options can vary, but they will always include combination treatments. And you need to understand the pros and cons of all of these things and make sure that you are choosing your provider wisely. So to recap, we talked about fine lines, wrinkles, we talked about dark circles, and then we talked about under eye hollowing, making sure that you're the right candidate for filler, that you're getting mid-cheek filler first, and that you are doing baby amounts of filler if you're getting filler at all in the under eye area, and that you're boosting. And that doesn't mean you're doing it at the same time. That means we're boosting it in layers. So maybe you come in and you get a little bit of under eye filler, and then 4 weeks later we assess and we do some PRP, or maybe we do some microneedling with exosomes, or maybe we do a skin tightening procedure. That is what I mean. We need to build out a 1-year treatment plan. So that's super important. Make a 1-year treatment plan for your patients. And if you're a patient listening, make sure you have a treatment plan and that you understand that addressing concerns in the under eye area is not a one-stop shop. It is a process. You need to understand the causes, the different options. You need to do a combination of all of these for best outcomes, and you need to be protecting your investment with at-home skincare. Thanks for tuning in to today's episode. I will see you guys next week. You can follow me on Instagram at The Perfect Dose. For more on injection techniques and specific protocols in my practice, follow me on Patreon.